Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about alopecia. In particular, I'll cover what is alopecia, how do you treat alopecia, and how you can better live with alopecia. So we start with what is alopecia. So alopecia typically refers to excessive hair loss from your scalp and can be the result of heredity, certain medications, or an underlying medical condition. And anyone, men, women and children, can experience hair loss. Some people prefer to let their baldness run its course untreated and unhidden. Others may cover it up with hairstyles, makeup, hats and scarves. And still others choose one of the medications or surgical procedures that are available to treat hair loss. The medical term for hair loss is alopecia. Pattern baldness or androgenetic alopecia, the most common type of alopecia, affects roughly 1/3 of men and women. Other types of alopecia are temporary, including alopecia areata. It can involve hair loss on the scalp or other parts of the body. So first we have permanent hair loss. So male pattern baldness. For men, pattern baldness can begin early, even in the teens or early 20s. Female pattern baldness for women with permanent hair loss usually have hair loss limited to thinning at the front, sides or crown. And cicatrical or scarring alopecia. This rare condition occurs when inflammation damages and scars hair follicles, causing permanent hair loss. Next is temporary hair loss. Alopecia areata is hair loss usually occurs in small, round, smooth patches around the size of an old 50 pence. Usually the disease doesn't extend beyond a few bare patches on the scalp, but it can cause patchy hair loss on any area that has hair, including eyebrows, eyelashes and beard. Telogen effluvium. This type of temporary hair loss occurs suddenly, most often after a significant illness or major life stress. Tractation alopecia. So this is bald patches can occur if you regularly wear certain hairstyles such as pigtails, braids or cornrows, or if you have or use tight rollers. Hair loss typically occurs between the rows or at the part where the hair is being tightly pulled. And anagen effluvium. In this type of hair loss, actively growing hairs in the anagen state are affected most often by chemotherapeutic drugs given to fight cancer or lymphoma. Hair loss starts soon after beginning therapy and is more extensive than in the telogen effluvium state. In the weeks after the therapy has been completed, the hair cycles re-establish themselves, although the hair may not return as thickly as before chemotherapy. So alopecia, the causes would be due to hormonal changes, irritation or damage. Some hair follicles have a shorter growth phase and produce thinner, shorter hair shafts. Your hair goes through a cycle of growth and rest. The course of each cycle varies by individual, but in general, the growth phase of scalp hair, known as anagen, typically lasts 2 to 3 years. During this time, your hair grows just less than 1 centimeter a month. The resting phase is called the telogen. This phase typically lasts 3 to 4 months. At the end of the resting phase, the hair strand falls out and a new one begins to grow in its place. Once a hair is shed, the growth stage then begins again. Most people normally shed 50 to 100 hairs a day, but with about 100,000 hairs in the scalp, this amount of hair loss shouldn't cause noticeable thinning in the scalp. Gradual thinning is a normal part of aging. However, hair loss may lead to baldness when the rate of shedding exceeds the rate of regrowth, when new hair is thinner than the hair shed, or when the hair comes out in patches. So next is, how do you treat it? Baldness, whether permanent or temporary, can't be cured, but hair loss treatments are available to help promote hair growth or hide hair loss. For some types of alopecia, hair resume growth without any treatment. So first is medicines or medications available. The effectiveness of medicines used to treat alopecia depends on the cause of the hair loss, the extent of the loss and the individual response. Generally, treatment is less effective for more extensive cases of hair loss. So minoxidil or Rogaine, this is an over-the-counter medicine and is approved for treatment of androgenetic alopecia and alopecia areata. Minoxidil is a liquid or foam that you rub into your scalp twice a day to grow hair and prevent further loss. Some people experience some hair regrowth or a slower rate of hair loss, or both. Minoxidil is available in a 2% and 5% solution, so mild and a strong. New hair resulting from minoxidil use may be thinner and shorter than previous hair, but there can be enough hair growth for some people to hide their bald spots and have some new hair blend with existing hair. New hair stops growing soon after you discontinued the use of minoxidil. It may take 12 weeks for new hair to start growing. Next would be finasteride or Proscar. This prescription medicine to treat male pattern baldness is taken daily in pill form. Many men taking finasteride experience a slowing of hair loss, and some may show some new hair growth. Positive results may take several months. Next is corticosteroids. Injections of cortisone into the scalp can treat alopecia areata. New hair may be visible 4 weeks after the injection. And also there is surgery. So the goal of surgery is to efficiently use your existing hair to cover lost ground. And finally, how do you live with alopecia? Chances are that the greatest challenge of losing your hair is coping with the change in your appearance. You may be frustrated or upset by other people's reactions, or after trying various treatments with little success. If you're having difficulty coping with baldness caused by heredity, a medical condition, or medical treatments, you may find some of the following suggestions helpful. So, first of all, learn about the cause of your baldness and treatment options. Be wary of alternative treatments that have no proven track record or may cause dangerous or unpleasant side effects. Educate those near to you. Your family and friends can be more sympathetic if they understand the cause of your baldness or your concerns about your looks. You may also learn that they are less concerned about changes in your appearance than you are. So the following tips can help keep your hair healthy and may minimize the appearance of hair loss. Eat a nutritionally balanced diet. Handle your hair gently whenever possible and allow your hair to air dry naturally. Avoid tight hairstyles such as braids, buns and ponytails. Avoid compulsively twisting, rubbing or pulling your hair. And finally, we have various supplements and products which you can purchase from us without prescription, such as Rogaine and Neurocrine tablets and shampoos and conditioners. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing alopecia with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.